the way, I want to thank all of you this evening for being here tonight. If you're not familiar with the Fenway Foundation for Friesian Horses, we are a nonprofit 501c3 based just outside of Appleton, Wisconsin in the United States. And we are dedicated to enhancing and preserving the health and longevity of Friesian horses through three primary focus areas: research, rescue, and education. And tonight we have a fantastic educational webinar for you on equine eye diseases. And we're going to talk about some Friesian specific eye diseases as well. And our presenter tonight is Dr. Kelly Knickelbein from Cornell University. Dr. Knickelbein is a graduate from the University of Pennsylvania School of Veterinary Medicine. She completed an internship in equine medicine and surgery at Rhinebeck Equine and a comparative ophthalmology internship at the University of California, Davis. Following this, she completed her residency in comparative ophthalmology. Following this, she is a diplomat of the American College of Veterinary Ophthalmologists. She thoroughly enjoys the comparative nature of ophthalmology, and her primary interests are equine ophthalmology, heritable ocular disorders, and ophthalmic imaging. So now I would like to turn the presentation over to you, Dr. Knickelbein. Welcome, and thank you so much for being with us here this evening.
Thank you very much for having me, and thank you for the intro, Angie. I appreciate it. So Angie kind of already mentioned my training. I've been super fortunate to train at some really incredible institutions with some really incredible mentors, both veterinarians and then pure scientists as well. And that's really why I'm here kind of talking to you this evening. I've had excellent training, which has allowed me to participate in some research projects that have, brought me here to be able to present. Okay, so we'll start with kind of a review of basic ocular anatomy, and then we'll talk through some of the common disorders that affect horse eyes. What we can see in this image is happens to be a gray horse, but everything we see here is normal. So the eyelids are normal. You'll notice the upper eyelid has numerous white, fine eyelashes, and those will come into play when we talk about distichia. You'll notice that the lower eyelid is lacking those lashes. So there's some fine hairs that line the lower eyelid, but there aren't true lashes there. Horses also have a third eyelid, which is a normal structure. You can see it on the kind of left-hand side of the image, tucked under the two eyelids there, is a pigmented structure, which is the leading edge of the third eyelid. And that structure functions to distribute the tear film, to moisten the cornea, and also to direct the tears towards the normal drainage system for the eye, which are two little holes near the medial canthus, which is that kind of inner corner of the eye. What we see the light reflecting off of here. There's two flash artifacts from the camera that was used to take this photo. And those lights are actually reflecting off of the cornea, which when it's healthy, we don't take much note of, but the cornea is the clear window kind of into the eye. And what we see inside of the eye here is the iris. So this horse has a pigmented iris. So it's a brown. You can see it's kind of has various shades of brown within it, and that's normal. And then there's a kind of oblong, a horizontally ovoid hole in the iris called the pupil. Our pupil happens to be round. Many herbivores have a horizontally ovoid pupil, like the horse shown here. And then there's some unique structures at both the top and the bottom of the pupil called the corpora nigra, or black bodies. Those are structures that actually originate from the back side of the iris, and then they extend out into the front chamber of the eye, and they serve as a shade. So in bright sun, the pupil will constrict down, and those structures will actually limit the amount of light that's entering the eye. And that's kind of a protective mechanism to protect the retina, which is the sensory structure in the back of the eye that allows for vision. It is incredibly light sensitive. And as you know, when you walk, outside on a bright day from a dim room, like walking out of a movie theater out into the bright sun, it can be pretty offensive. So this is a really nice adaptive anatomic point that herbivores have. Horses in the natural world spend all of their time outside, and so they don't really have a lot of protection from sun. So this is a nice adaptation to protect from that. In the center of the pupil, or just behind the pupil, is a structure called the lens. And like the cornea, when it's normal, it's not very notable. It's translucent, it allows light to pass through, and it actually bends light, and it allows the light to hit the retina precisely to allow for acute vision. We can go ahead and go to the next slide, which shows the back of a horse's eye. So this is a normal, what we call the fundus, the ocular fundus, and that just is a term used to describe kind of the back wall of the eye. And the structures that we're seeing here are the retina, which is mostly translucent, where we can actually see the retina is right around that kind of ovoid pink structure. That ovoid pink structure is the optic nerve. And there are small little red lines, curved lines lying over top of that. Those are retinal blood vessels. So those blood vessels are within the retina. Otherwise, it's not very notable. It's a thin, very thin tissue, and it's translucent. So unless there's disease, we don't see much of it. What we're seeing, though, is what's just behind the retina, and that's a vascular layer called the choroid. This horse happens to have a lot of pigment in its choroid. So what we're seeing here is just kind of the dark brown, black pigment. And then the bright green structure is something called the tapetum lucidum. That structure is within that vascular layer, the choroid, and it's another kind of adaptive anatomic structure to improve vision in low light levels. So this structure actually sits behind the retina, and what happens in dim light is that light will enter the eye, it will pass through the retina, some of it will be absorbed, and that will be transmitted to create, transmitted to the brain to create an image, to create vision. Some of it will actually pass through the retina and bounce off of this reflective layer and then go back towards the retina. And it so essentially allows for a second chance at capturing that light to allow for vision. And many animals do have this structure. Again, it's called the tapetum lucidum. You've probably noticed it if you are ever driving at night and you see an animal on the side of the road, you may see a kind of a bright flash in their eyes, or even taking photos of your own pets, you may see kind of this bright flash, and that's due to this structure called the tapetum lucidum. Alrighty, we can move on to the next slide here. So we'll talk now about some common eye problems. Unfortunately, ocular disease is incredibly common in horses, whether it be, a congenital disease or acquired. They do have very prominent eyes that kind of sit out on the sides of their head, as we all know, so are very prone to trauma, as well as other exposures to the environment. Corneal disease is incredibly common. So we see corneal ulcers, abscesses, which indicates an infection kind of trapped in the cornea, and then also some non-infectious inflammation of the cornea, which we classify as immune-mediated keratitis. We see uveitis very commonly in horses. Uveitis describes inflammation of the uveal tract, which is the kind of vascular tunic of the eye. And that's composed of the iris, the pigmented structure that we're used to seeing when we look at people's eyes and animals' eyes, as well as that choroid that I mentioned, that vascular layer underneath the retina. So uveitis is inflammation of those tissues, and there's a few common causes of uveitis in horses. Very common disease is known commonly as equine recurrent uveitis. Some people refer to this as moon blindness, or even periodic ophthalmia. That's another term for the same disease. That's an immune-mediated condition that also has some genetic predispositions in certain breeds. We do see traumatic uveitis, and we see uveitis secondary to things like corneal ulcers and abscesses very frequently. Other conditions that we see commonly, cysts of the corpora nigra. So the corpora nigra, again, are those structures that emanate from behind the pupil. They serve as a shade to limit light entering the eye. Cysts can arise there. We can see cataracts, which are opacities of the lens. And then squamous cell carcinoma is by far the most common tumor that we see arising on and around the eye. And we'll talk a bit about why that occurs and the breeds that are predisposed to it. Can go ahead and advance.
We do have one question on uveitis and the breed disposition. So the question is specifically the recurrent uveitis or immune-mediated keratitis, is that specific to Friesians, or is there an increased breed disposition for that?
So luckily not specific to Friesians. These are covering kind of just general diseases here that any horse could be affected with. Friesians are not predisposed to immune-mediated keratitis or uveitis, though they certainly could get it. The breeds that are predisposed to equine recurrent uveitis are Appaloosas, and then the other breeds that have the similar leopard complex spotting pattern. So ponies of the Americas, Kanab's troopers, some miniature horses. And then some warm blood breeds are also prone to uveitis. We don't know of any breed predispositions yet to immune-mediated keratitis. It seems to affect a lot of different breeds, so we're not sure if there's any true breed predisposition to that. Okay, so we'll talk first about corneal ulcers. A corneal ulcer is simply when the surface layer of cells of the cornea, the epithelium, is missing. And they can occur for numerous reasons. Probably the most common reason that we see is due to trauma. So, there's so many things in a horse's environment that they could potentially scratch their eye on. Often it's, plant material when they're out grazing. It could be something minor in the stall. We can, though, see ulcers as a result of things like chronic inflammation inside of the eye, leading to poor corneal health. What we worry about a lot with ulcers in horses is that because of their environmental exposures, they're really prone to getting infected when they do have a corneal ulcer. So obviously really important to kind of monitor your horse's eyes. At the first sign of any problem with an eye, should call your vet and have them, come out and take a peek, because if it is something simple, like a small superficial corneal ulcer, the quicker it gets treated, the more likely it is that it's going to heal without issue and not become infected. The corneal infections that we see secondary to ulcers are often bacterial. So all kinds of different bacteria in the environment. There's also bacteria that normally live on the surface of the eye. They live in the tear film and in the conjunctiva, and those can actually invade into a corneal ulcer when it occurs. And then horses are also really prone to developing fungal infections of their cornea because of their environment. There's fungus pretty much everywhere. Depending on the season, it can be particularly bad. And depending on the area where you live, the humidity, that kind of thing, fungus is certainly more common in some parts of the country and the world than others. But it is pretty much everywhere that we're seeing fungal keratitis now. So this is just an example of a corneal ulcer that has become infected, and kind of worst case scenario, the infection kind of ate through the entirety of the cornea, and it developed a full thickness hole in the cornea, and that's what we call a corneal perforation. So in the image on the far left, you can see the cornea, which is normally translucent or clear, is really cloudy blue, and that's due to fluid that's accumulated in it due to the perforation. There's also a lot of inflammation inside of the eye contributing to that. And then just under the upper eyelid there's a defect, kind of a hole in the cornea, and that's the site of the perforation. So this horse underwent a surgery called a conjunctival pedicle flap. He actually had a corneal transplant. So donor cornea was placed into the deep part of the defect, and then it was covered with a conjunctival pedicle flap to try to stabilize that hole and to provide a blood supply there to help clear the infection and to allow the eye to heal. So you can see in the photo in the middle, We're still kind of well underway in the healing process. There's a lot of blood vessels present in the cornea. The cornea is still pretty cloudy, but the graft that we've put on, that conjunctival graft, looks to be healing well. And then in the image on the right, a lot of the residual corneal inflammation and cloudiness has resolved, and we have a conjunctival graft that's healed. The inside of the eye looks clear. There's no longer inflammation. The eye's held open. And fortunately, this horse was able to maintain vision from the eye, though certainly has a large scar, a large opacity from the site of the rupture.
So does that flap just stay in place then?
Yeah, that's a great question. So we often trim these. So the area where we trim is called the pedicle. The part that is kind of initially sutured into the cornea around the defect will remain there. But if we trim the pedicle part, we essentially cut the blood supply to the graft. And instead of looking like this big, ugly pink piece of tissue, it starts to look more like a whitish gray scar, and it will kind of flatten out a bit. The other thing that can happen with these, whether or not the flap is trimmed, is that they can lay down a lot of pigment on the surface of these. And so instead of looking pink, it may look kind of dark brown or black.
We have a question from Donna, and she said she was told by a veterinarian that she was working with at the University of Georgia that this surgery is more like a 50-50 chance of working due to the Friesian curve of the eye. Is that true, or is there something specific about the Friesian curve of the eye?
Yeah, so that's a really good question. We're going to talk a little bit about this when we talk about corneal stromal loss, but short answer is I don't know. I don't know if the curvature of the Friesian cornea is different from the other, average horse that we see. We do know that Friesians with corneal stromal loss can have prolonged healing. They can have complications when this type of surgery is performed to treat bilateral corneal stromal loss. So I wonder if that might be what they were referencing. We do, with any eye that is perforated, even despite our best efforts with a surgical stabilization like this, we sometimes do lose these eyes. Sometimes they just don't heal as we hope they will. And so prognosis for these eyes is certainly guarded, but the best case scenario is when we're able to do a surgical repair and they heal appropriately. So it's a good question. I'm sorry, I don't have a solid answer for you there.
Donna just said, yes, that's what they told me. So that tracks with what she was told. So. Okay. So a corneal stromal abscess is when the cornea is not actually ulcerated. So that surface layer of cells is intact, and we assess the kind of integrity of that surface layer of cells by using something called fluorescein stain. A lot of you are probably familiar with that. It's a green stain that when there is an ulcer, it sticks to the underlying layer of the cornea, the corneal stroma. With a corneal stromal abscess, there is no retention of that fluorescein stain. So it indicates that that surface layer of cells is in fact intact, but there's an infection trapped underneath it. And so this type of thing, a corneal stromal abscess, typically happens due to either like a microtrauma, something penetrating the cornea and setting up an infection, or if there's a previous ulcer that then heals and that infection gets trapped below. So some examples of infections in corneas that are fluorescein negative, and these would be classified as stromal abscesses. Immune-mediated keratitis is an increasingly common disease that we're seeing. It does not have an underlying infectious cause that we know of, and that's kind of a really important point. Any horse that has an opacity of its cornea, the first thought should be the potential for infection, and we kind of want to rule out any infection before we would think about using anti-inflammatories, particularly immunosuppressives like topical steroids, which are often necessary to control this type of disease.
We don't know a lot about why this disease occurs. We do think it's driven by the horse's own immune system. It typically starts out as a relatively mild disease, but it does tend to be progressive even despite treatment. And it can lead to really significant opacity of the cornea that can impact vision. There's a lot of different treatment options for this, medical, so topical anti-inflammatories. We have something called a cyclosporin implant. Cyclosporin is a drug that's a kind of mild immunosuppressive, immunomodulatory. So you can put implants under the conjunctiva as kind of a means of providing long-term slow release of that medication to try and control the disease. Often we end up doing something called a keratectomy, where we actually remove a small superficial piece of the cornea. And we don't know exactly why it is that it seems to be so effective, but for many horses that provides them pretty long-term control from this type of inflammation. In doing that procedure, we do create an ulcer. So we kind of create risk of infection. We open up the cornea, allowing for the potential for infection. We, of course, treat to try and prevent that. We use prophylactic antibiotics, sometimes antifungals, and pain medications as well. But it does tend to have a good, outcome in terms of limiting chronic inflammation of the cornea. However, it will create a scar. So kind of a balance there. We have a lot to learn about this specific disease. Okay, and then uveitis. We've talked a little bit about uveitis already. So again, this is inflammation of the vascular tunic of the eye. So the iris, the ciliary body, which is the structure just behind the iris, and then the choroid. Uveitis is incredibly common in horses. Equine recurrent uveitis is, again, kind of the most common name given to uveitis, but we see uveitis for many, many different reasons. What we'll call equine recurrent uveitis is an immune-mediated condition, very common in Appaloosas and some warm blood breeds. However, we do see it across breeds. Pretty much in every breed, you can expect to see uveitis. We know there are some genetic predisposing factors. Appaloosas that have 2 copies of the leopard complex spotting are at highest risk for having uveitis. And that also is true for ponies of the Americas, miniature horses, knapstrippers, other horses that have that same coat color, genotype and phenotype. There are also known environmental exposures that can potentially set horses up to have chronic inflammation inside of their eyes. The best known is a bacterial organism called Leptospira. It's not always as simple as a horse becoming infected with this organism and the organism moving into the eye to cause inflammation. In some horses, we think that just exposure to the organism can lead to an autoimmune inflammation targeting the eyes. So there's a lot of kind of debate over whether, treatment with antimicrobials to kill Leptospira is appropriate in these cases if it hasn't been documented that they have an intraocular infection. What we do know, though, is that some horses, when treated as if they had an intraocular infection, can improve significantly even if they don't have an intraocular infection. So there is quite a bit of debate over kind of best practices for treating equine recurrent uveitis in horses right now, certainly kind of outside the scope of our topic tonight, but also a disease that we have, a lot to learn about. Unfortunately, uveitis, equine recurrent uveitis, is a really common reason that horses go blind, probably the most common reason that horses go blind. And while in some cases it affects only one eye, in a lot of cases it does affect both of their eyes. And so it's a quite common reason for horses to no longer perform at the level, not able to be used as a riding horse any longer. Unfortunately, it's also a common reason that a horse may be put down. So it's a crummy disease that a lot of people are trying to figure out how we can best manage. This is just an example of a horse diagnosed with uveitis that was treated kind of with the gold standard treatments, and despite that ended up losing vision in this eye. So these photos were taken over a series of about 18 months. And you can see the eye looking very different in each of them. The top left is the beginning of treatment, and then the bottom right is the eye at the last recheck. The horse unfortunately underwent a lens luxation. At one point, the lens moved into the back of the eye, then it moved into the front of the eye. The retina became detached, which was the cause of vision loss in this case. And you can see the eye just very inflamed in that final photo on the bottom right.
So would we be able to tell like as an owner, if let's say you have a horse with uveitis, you've got one with maybe she's got an ulcer from a scratch. I mean, what does it look like to the owner, all of these different cases? It's just going to be, squinty, teary eye, swollen, painful. Are they all similar in the way they present, like from like a layman's view as an owner?
Yeah, it's a really, really good question. And the thing about ocular disease is that a lot of the clinical signs that an owner would see are non-specific. And that's why when you're dealing with an eye, it's really a good idea to have, your vet come assess the situation as soon as possible. Most common clinical signs that we can see for a corneal ulcers, stromal abscess, immune-mediated keratitis, uveitis would be squinting, so holding the eye partially or fully closed, tearing or other forms of discharge, so just excessive tearing to having mucoid, kind of gray-white, or even mucopurulent, kind of that yellow-green thick discharge coming from the eye, and then cloudiness to the eye itself, and that cloudiness can be an ulcer, an infected ulcer. It can be edema if the horse has uveitis or high pressures. So unfortunately, a lot of the signs are really non-specific. One thing should mention about uveitis is that, and I think one of the reasons it's such a devastating disease is that a lot of horses show no outward signs at all that they're having this intraocular inflammation. So they're not squinting, they don't have discharge, they hold their eye open, it doesn't look cloudy, but inside of the eye, they're having this chronic low grade or these episodes of inflammation that are slowly really changing and scarring the tissues inside of the eye, leading to damage that will eventually take their vision.
Mm.
This is a disease that's kind of less of a bummer than the ones we've talked about so far. Corpora nigra cysts. So the corpora nigra, again, are those kind of bulbous structures that come off from the iris and kind of hang into the pupil. They are cystic structures. They have a little bit of fluid in them, but the kind of cystic nature to them is very, very small. Occasionally, you'll see a horse that develops kind of a larger cyst. And you can see in each of these photos, there's one arising from the bottom aspect of the pupil in each of the three photos. And then in the photo on the far left, there's a second one coming from the middle of the upper aspect of the pupil there, or the iris rather. And when these get large enough, they certainly can impact vision. So when the pupil gets really, really small, and that happens out in bright sunlight or in a well-lit arena or barn, the pupil will constrict, and these cysts can actually block some of the horse's visual axis, and it can make them, behave differently. It can cause them to spook because they are just not seeing the world the way that they're used to seeing it. These are pretty easy to treat if you have the proper equipment. So what we do is essentially just laser a small hole into the cyst to deflate it. It can potentially recur. I have not yet seen one recur, but in theory it could. And then there's always a potential that new cysts could form within the eye. However, the success rate for this procedure in kind of getting rid of the cyst is high. Whether or not that changes the horse's, vision or behavior, it's hard to determine as someone that's just seeing the horse, that one time to laser the cyst. But what we know from owner reports is that horses that are known to have vision issues associated with these cysts do have them seem to resolve upon lasering them. The laser that we use, oh, sorry, Angie. The laser that we use targets pigmented tissue. So there is some risk to the procedure. The risks we usually discuss are corneal ulcers and cataracts, really, really unlikely to occur because the wavelength of the laser is specific for pigmented tissue. What we do know will happen is we cause a bit of inflammation inside of the eye by doing the laser. So we kind of preemptively treat for that to minimize the effects of it. And this procedure, again, tends to be very well tolerated, so a low risk procedure. All right, cataracts. So cataracts are simply an opacity of the lens, and the lens is that structure that's sitting just behind the pupil. It's normally transparent, and its role is to allow light to enter the eye, to get to the back of the eye to hit the retina, and it actually bends that light so that it hits the retina on a really specific point to allow for acute good vision. So when there's an opacity of the lens, and you can see in each of these photos some white-gray opacity within the pupil, that's going to, limit the amount of light that's entering the eye and potentially impact vision. If it's a very small cataract, it is unlikely to significantly impact a horse's vision. If it's a large cataract, like the one shown in these photos, and certainly if it progresses, it can significantly impact their vision. The top image on the right, where the pupil is completely white, that's an example of a horse that would be completely blinded by that cataract. They would have light perception so long as the rest of the eye was healthy, but they would not be able to have functional vision from that eye simply because the cataract is precluding them from seeing. We do offer cataract surgery for horses. I should say the most common reason that we see cataracts is actually secondary to inflammation inside of the eye. And those horses that have uveitis and cataracts are not good candidates for cataract surgery because their eye is already really inflamed, and surgery will make it more so inflamed. Horses that have primary cataracts, so cataracts that they were either born with or that are potentially hereditary that develop later in life, are better candidates for cataract surgery, but it is still a relatively high risk surgery.
Susie wants to know, can cataracts happen at any age? Can they happen like when a horse is really young, or is it just older horses?
Cataracts can occur at any age. They can be present from birth, which we refer to as congenital cataracts, or they can develop later in life and still be potentially genetic in nature, or they can be acquired for other reasons due to uveitis, due to trauma. There are many reasons that a horse can develop cataracts, but they can occur at any age. We'll move on to squamous cell carcinoma. So squamous cell is the most common tumor that we see affecting both the eye itself, so the ocular surface, as well as the eyelids in horses. And there's a few different locations where we tend to see it most frequently. It can occur on the surface of the eye, arising from the conjunctiva, which is that pink mucous membrane that kind of surrounds the cornea. It can invade the cornea itself, which is seen in the top photo in the center. And then a common location where we see it is arising right at the junction of the conjunctiva and the cornea, and that's called the limbus. And the top photos, the left and the right end photos on top, are both examples of that. We see it really commonly affect the third eyelid. So that was the structure I mentioned at the very beginning when we were reviewing the normal anatomy. That horse had a pigmented leading edge of its third eyelid. The photo on the bottom right here shows a horse that has a non-pigmented third eyelid, and there's a large pink mass growing from that. So that's another common location. And then the photo in the center on the bottom is a horse that has just a really large tumor that's affecting multiple different areas. And it was unclear whether or not that tumor started on the eye itself or from the third eyelid. It definitely invaded the lower eyelid and was really, really extensive to the point where this eye had to be removed, and not all of the tumor could even be excised given that. There are several breeds that are predisposed to developing squamous cell on the surface of their eye. Those are the Haflinger, the Belgian draft horse, Rocky Mountain horses, Connemara ponies, and then a few other breeds that are kind of more uncommonly affected. But this is a real problem for these horses. These tumors can be aggressive, and it can be a reason why a horse may need to be put down if the tumor is not, caught early enough and treated. Recurrence of this tumor type is also very common, because even when it looks like you've removed it all kind of grossly, often there's tissue invasion beyond what you can see. We also see squamous cell commonly affect the eyelids of horses that lack periocular pigment. So paint horses are kind of the classic for that, but any horse of any breed that lacks pigment on their eyelid skin and around their eye can be more prone to developing these. We know that UV exposure has a huge role in the development of this tumor.
So if you have to, go in there and do surgery to remove it, is there risk of, irritating the tissue surrounding it and it spreading? Is that something
Yeah,
that happens?
that's a very good question. Thankfully, this tumor type doesn't tend to spread to other parts of the body very commonly. It can, but it tends to do that in very late stages of disease. So what we worry about more is just not being able to excise all of the tumor. And if we're trying to do a tumor excision, but preserve the eye to preserve vision, we're actually a bit limited in, how much tissue we can remove without compromising the eye and compromising vision. So whenever we do surgery for this tumor type, we're always doing a surgery, so a surgical either debulking or removal of the tumor, and some other form of either chemotherapy with medications or cryotherapy to freeze remaining tumor cells. We use radiation therapy for some of these cases as well, because we kind of expect that we're going to not be able to remove every single tumor cell. And so we have to use some sort of adjunctive to try and kill off cells that remain there. So we'll move on now to talking about genetic diseases. And again, we'll focus on the two genetic ocular diseases that we know of in Friesian. So just kind of the basics of genetic diseases in horses. Genetic diseases are those that are caused either in whole or in part by a change in the DNA sequence away from what's considered the normal sequence. And these diseases may or may not be present from the time of birth. A lot of genetic diseases are present from birth, but some are not, and some may not manifest until adulthood. And then when we're dealing with genetic diseases in horses, or diseases that we suspect are genetic, we kind of look for breed association. So whenever we see a certain disease happening in a certain breed more frequently than we see it in other breeds, that's when we get suspicious that that disorder may have a genetic basis in that breed. One example of a disease that may not manifest until adulthood, even though it has a genetic basis, is actually the ocular surface squamous cell carcinoma in Haflingers and Belgians and the few other breeds listed. These horses have essentially a defect in a protein that is involved in repairing UV damaged DNA. So anytime we're out in the sun, we have exposure to UV light. It does does damage our DNA, we have internal mechanisms to try and find that damage and correct it so that we don't get skin cancer or, eye cancer, those kinds of things. These horses that have a genetic predisposition to ocular surface squamous cell carcinoma, one of the proteins that's involved in kind of scanning the genome to find that damage and call in other proteins to help repair it is defective. So they're unable to even find that they have this damage, and thus they're unable to repair it. So they're born with the defect in that protein, but they also have to have lived for a little while, had the sun exposure to accumulate enough damage to develop the tumor, because they lack that protein that can't come repair it. So just one example there of how a genetic disorder doesn't always manifest from birth. Okay, and Friesian horses are certainly not the only, breeds that are only breed that is impacted by heritable or genetic ocular disorders. There are a number of ocular disorders that are well documented as being genetic in many different breeds. So I have several of them listed here. Those that have an asterisk are the diseases that actually have a genetic test available for them. So we'll talk more about distichiasis and bilateral corneal stromal loss. Other known genetic disorders that affect the eye in horses are multiple congenital ocular anomalies, and this is associated with the silver coat color in Rocky Mountain horses and several other breeds. That disease has kind of two forms, a more mild form and a more severe form. The more severe form certainly does impact vision. And so the fact that we have a genetic test for that is excellent to try and kind of, breed away from that severe phenotype, but still preserve kind of the desired traits in that silver coat color. Congenital stationary night blindness is another. There's actually two forms of that disease, one in Appaloosas and then another in Tennessee walking horses and standardbreds. And this disease is a disease of the retina, where these horses actually cannot see in really dim light or at night. So their day vision is totally normal, but they have essentially no functional vision in really dim light conditions. And this is certainly a condition that's underdiagnosed. A lot of people don't spend a lot of time with their horses in the pitch black. Usually they have lights on or are working them during the day. So this is a really interesting one. Ocular surface squamous cell carcinoma, we've talked about quite a bit already. There is a genetic test available for the breeds listed here. And then uveitis is another. There is a genetic test, so it's the same test for the leopard complex spotting coat color in the Appaloosas and other breeds with leopard complex spotting. There is not currently a genetic test available for the warm blood breeds. And then cataracts are known or suspected to be heritable or genetic in many breeds. We do not currently have any genetic tests available for cataracts in horses. Okay, moving on now, we'll talk more thoroughly about distichiasis and then bilateral corneal stromal loss. The photo on the bottom left here, I have an enlarged photo on a slide coming up, so we'll chat more about it there, but that's an example of distichiasis. And then the image in the middle is a horse with bilateral corneal stromal loss, obviously showing just one eye there. Okay, so distichiasis describes a condition where the eyelashes are, instead of growing out of the kind of skin away from the eyelid margin, these hairs, also called cilia, are growing directly out of the eyelid margin, and they're actually growing out of little glands that are called meibomian glands. Those glands produce a part of the tear film. So the meibomian glands are a normal structure. They create a fatty, oily part of the tear film. They do not normally have hair growing from them, but in this condition, distichiasis, they do. And if you don't mind advancing, Angie, I think it should bring up, some enlarged photos. And then there's one more, if you could advance one more time. So these enlarged photos allow you to hopefully see these black hairs that are growing right out of the eyelid margin. there. And you can imagine if you've ever had anything on the surface of your eye, you know how irritating that can be. So just imagine having these coarse little hairs just constantly touching your cornea. These can be a cause of pretty, severe discomfort and irritation for some animals. The hairs that are kind of long and fine, like the ones in the image on the right, these ones are kind of pointing out a little bit more. These ones maybe are not so irritating, but the ones on the left, those kind of short, fat little hairs that are really firm, these can be really, really irritating for horses. Just another example here. This horse is kind of looking over to the other side, allowing the distichia to overlie the conjunctiva instead of the cornea, so you can see them a little bit better here.
What's interesting about this is you imagine when you hear this disease described that there's all of these aberrant eyelashes coming all over the place, poking, the eye. But, as you can see in this picture, it could just be, a small number that I think would be very difficult as an owner to observe visually. Is that correct?
Yeah, absolutely. The severity of this disease in terms of the number of aberrant hairs can be really variable. There are certainly some horses that have a ton of hairs, and there are some that have just a few. And seeing these with the naked eye is really, really difficult. So, if they aren't bothering the horse, if the horse doesn't have irritation from them, it would be really easy to overlook these. And this is an example of a horse that, despite the photo, only having a few, this horse was really irritated by the distichia and had numerous corneal ulcers and corneal inflammation and quite a bit of scarring of the cornea as a result of these distichia. One reason why, there may be only a few hairs seen in some of these images, it may just be that these horses have less severe disease. But the other kind of important thing to realize with this disease is that these hairs do grow and fall out just like any other hair would. So at any given time, you can have hairs in kind of different stage of the hair growth cycle. And just because there's not a distichia kind of in one portion of the eyelid today doesn't mean that there's not one in there growing that's going to come out of the lid margin at some point. So it's always hard to know, how many of the meibomian glands are truly growing hairs or not. So clinical signs of distichiasis are kind of the standard non-specific signs of an eye disease. So squinting, holding the eye closed. Sometimes they'll rub and their eyelids will become swollen. They'll have excessive tearing. They'll have a corneal opacity, so a cloudy eye due to corneal inflammation. Some horses will develop corneal ulcers, and then those ulcers can cause scarring. So kind of the classic corneal signs are what we expect for this. Treatment options for distichia, so kind of focus around removal of those hairs. Epilation is a term that just essentially describes plucking, so pulling the hairs out. Pulling them out does not address the hair follicle that's causing the hair growth. So if they're just pulled, they will regrow. So one option, if they are irritating, would be to epilate them. I mentioned already that, there may be hairs in different stages of the growth cycle. So it's not like you can pluck them all at once and have all of them be removed for the same period of time. They're going to grow at different rates and they're going to be present at different times. So not a great option. Also not very well tolerated by most horses, as you can imagine. Electroepilation and cryoepilation are the other options. So electroepilation aims to destroy that hair follicle with heat. And then cryoepilation, kind of similar process, aims to destroy that hair follicle with freezing. And this is a kind of a particularly unappealing treatment option for many Friesian owners because the cryotherapy usually does result in the lid becoming depigmented. That is often temporary. The pigment usually returns to the lid, but there is some risk that it could be a permanent change. And so obviously our beautiful Black Friesians, we don't want them to have white spotted eyelids. And so not the best, treatment option for the breed, unfortunately. The important thing to realize with either of these, either the electroablation or cryoablation, is that by destroying that follicle, we're also probably going to destroy the meibomian gland itself. And those glands are important to the normal health of the tear film, health of the cornea. And so it's not, a treatment that is without any risk. If we destroy enough of those glands, it could impact their corneal health as well. So just something to think about there.
I have a couple questions.
Yeah.
Laura wants to know, will horses with distichiasis more commonly have issues in both eyes, or is it possible to just have the distichiasis in one eye?
Yeah, that's a very good question. Most often it's both eyes that are affected. I'm sure there's a horse or two out there that may just have distichia in one eye, but most commonly it affects both eyes. And interestingly, in the one study that we'll talk about there, the lower eyelid is more commonly affected than the upper eyelid. And that's interesting to me because the lower eyelid actually kind of lacks true eyelashes in horses. The upper eyelid has a lot of them, but the lower eyelid lacks those true eyelashes. So it's interesting that the distichia tend to be more common in the lower lid.
Well, the next question is, can you give us an idea of like the cost for these different treatments?
Yeah, that's a really good question. That will certainly depend a bit upon your vet, and what they charge. But luckily, these are procedures that can be done standing, so with just sedation and some local and topical anesthesia. So we're talking in the probably couple $100 range, not couple $1,000 range.
And the next question is this a one-time treatment, or does it have to be done multiple times?
Yeah, that's a really good question. Actually, if you want to go to the next slide, I think I have a little, yeah. So this
There
is
you go.
a retrospective that looked at treatment of equine distichiasis. And it says with a special reference to the Friesian horse because 17 of the 18 cases were Friesians. These, of course, were horses that were presented to the hospital for evaluation. So all of them had clinical signs, which is why they were presented. About half of them, so 45%, did have corneal ulcers that were thought to be associated with the distichia, and they were treated with electrocautery, and about 54% had recurrence. So hopefully that can answer your question that it's not a perfect treatment. The goal is to, destroy that hair follicle. But again, we don't want to, kind of fully destroy all of the meibomian glands. So depending on how severe they are, it's possible that we're either under treating or that the follicle is just not dying with the amount of electrocautery that we're willing to do on the lid. So recurrence is definitely a potential.
Okay, I think that answers all the questions for now.
Awesome.
Do you want to advance to the next slide?
Yeah, yep. So what do we know about the genetics of distichiasis? We do know that there is a large deletion on equine chromosome 13 that is associated with this disease. That large deletion and the genetic work that has been done suggests that it is inherited as an autosomal recessive, meaning that you have to have 2 copies of the large deletion in order for distichiasis to manifest, but that it's incompletely penetrant, meaning that even if you have those 2 copies where you have that large deletion, you may not have distichiasis. So kind of complicated here. If you want to advance to the next slide, we'll kind of talk through the genetic work that was done to try and sort this out. So a genome-wide association study was done. And what that means is that essentially the genomes of horses with distichiasis, so Friesians with distichiasis, were compared to the genomes of horses that were confirmed to not have distichiasis. And then we look for differences in those genomes. So what part of the genome is different in horses that have the disease versus those that don't have the disease. And we use markers that are kind of spread out across each of the chromosomes to kind of point us in the right direction of where we should look within the genome. So this was the genome-wide association study that was performed by Dr. Ballone's lab, which showed kind of two peaks of interest, one on equine chromosome 5, so the pink there. You can see there's kind of a high peak. We call this the Manhattan plot because it looks like a cityscape. So the taller the building, the more significant that area of the genome in terms of it being potentially associated with the investigated disease. So the peak on 5 is of interest, and then the peak on 13, which is in green, were of interest. And this study used 14 horses confirmed to have Distichia and 38 horses confirmed not to have Distichia, all Friesians. You want to go ahead and advance to the next slide. So what they found was that the region on chromosome 5 that seemed to be significant didn't actually hold up when they tested it in a higher number of horses, but the region on chromosome 13 did. So that seemed to be the most associated. So a few horses, three affected and two unaffected horses underwent something called whole genome sequencing, where their entire genetic makeup is sequenced, and then that sequence is evaluated on software. So what you're seeing here is actually the sequence evaluation, and the top 3 horses had Distichia, the bottom 2 did not, and this is representative of that large deletion on chromosome 13 that's been associated with distichiasis. So each of the horses that were sequenced that had Distichia lacked this area of their genome, had this large deletion, whereas the 2 normal horses did not. They had, they had DNA there. They didn't have the large deletion. And so then this area was sequenced in a larger number of cases, 19 cases, and it was found that 18 of those 19 horses with Distichia had this same deletion. The deletion is in kind of an intergenic region, and what that means is that there aren't genes in that area that we know of. So genes are kind of the regulatory factors that make proteins, which function to kind of control all the different, processes within our bodies. So no known genes in this area, but it must have some impact on the genome for this area to be missing. And what that is, we just don't know yet. So it's not known if this deletion is actually what causes Distichia, or if this deletion is just inherited, with whatever is causing Distichia, and it's a marker for the disease. Regardless, the fact that 18 out of the 19 affected horses had this deletion and that none of the control horses did indicates that it is significantly associated with the disease, and it's appropriate to use it as a genetic marker, a genetic test for distichiasis. If you don't mind advancing, Angie, on that note, there is a genetic test available. Dr. Ballone spoke to the group. When was that? Last summer? Must have been last summer.
I think it was last year sometime.
Yeah, kind of about the development of this genetic test, and it is commercially available through the UC Davis VGL, if anyone is interested in more information there. So we'll move on now to bilateral corneal stromal loss. So this is a very strange disease that so far has only been recognized in Friesians. There are some kind of reports out there, nothing published that I'm aware of, but some reports of halflingers potentially having a similar type of change that can occur to their corneas. But what you're seeing here is essentially little holes that are developing in this horse's cornea, and these can go from being kind of not noticeable to causing a perforation, so a full thickness defect, really, really quickly. if you want to go ahead and advance, we'll talk through kind of how this condition was discovered. And I purposely made this photo kind of small because I know it's going to gross a lot of people out. So this was a kind of retrospective case series out of the University of Pennsylvania New Bolton Center from Dr. Mary Lasseline that was published in 2014. So she, along with some colleagues who were practicing kind of all over the world, recognized that they were seeing Friesians commonly with either corneal perforations or these really deep defects in their corneas that didn't really have the typical clinical signs of a corneal ulcer. So they're not really painful. They don't have inflammation of their cornea. They don't have inflammation inside of their eye. Often these eyes are wide open, no discharge, but they have a hole, a progressive hole forming in their cornea. And it affects both of their eyes, though the onset may not be at the same time. One eye may happen first, and then the other eye may happen weeks, days, weeks, months, years down the line. The average age of the affected Friesians was 10 years. Interestingly, 8 out of the 9 cases were male, so definitely a male predisposition. And then unfortunately, about half of the eyes, truly half of the eyes, 9 of the 18 eyes did perforate, so developed a full thickness hole. Many of them did undergo surgical repair and were able to maintain vision, but it's a really inflammatory and painful process for an eye to perforate. So based on the fact that this was seeming to happen just in Friesians, a pedigree analysis of the affected cases was performed, and each of the affected horses in this study could be traced back to a common ancestor of the Tettman line. So again, this seems to be a spontaneous disease. These horses lack any known trauma that might incite this change to the cornea. And we do know that it's progressive. A variable age of onset. Some horses were younger, some were very old, but an average age of 10. Males definitely more affected than females. Again, it may start in one eye and then affect the other, though some horses present with both eyes affected, and they tend to lack signs of discomfort as well as corneal and intraocular inflammation. And I think you can get kind of a hint of that with the photos here, of the eyes at the bottom. These eyes are just wide open. The pupils are, kind of a normal size. The pupil in the right eye, which is the left image here, had been dilated. That's why it's bigger. But this cornea, these eyes have not ruptured yet. This is a very, very deep ulcer present here. But this cornea doesn't have that same cloudiness that those eyes that had ulcers, a few slides back at the beginning had. So this stromal loss is happening without a lot of inflammation going on around it. And we don't know the reason, why this stromal loss is happening.
So we don't know if it doesn't appear to be from an injury, or like in a case of an ulcer from a scratch where it gets infected and then that gets out of control. That doesn't seem to be what's happening here, correct?
That's exactly right. Yeah, they lack those indications of, they lack the history of trauma. They lack any indication of infection. Often when there's an infection in the cornea, we do see the cornea becoming thin. However, we also see a lot of cells coming into the cornea, blood vessels coming into the cornea, and often that corneal infection induces a lot of pain. And these eyes are wide open, comfy, despite the fact that they have this loss of stroma. So
I've read a few of the papers on this, and I did note that there was mention in at least one paper of a possible connection to connective tissue. Do you recall reading that? Or
yeah, we're going to talk a little bit about that. If you want to go ahead and advance, it may even be a few more slides. I should, if I don't bring that up again, remind me and we can chat about it, but I'm pretty sure I'll talk about it. So this is just an example of how this eye, this disease can occur. So this horse's history, this is a middle-aged Friesian gelding. He presented for an ulcer in his right eye in March of 2016. that eye had a lesion consistent with bilateral corneal stromal loss, even though, the one eye was affected at that time. So he had surgery on his right eye. He had a conjunctival pedicle graft performed. It was successful. His left eye was very closely monitored throughout his time in hospital for surgery, and it never changed. So the photo on the left is from, that time when his right eye had surgery. He has a nice, healthy, clear cornea here. Sure enough, 6 months later, we had advised his owner, this often will go on to affect the other eye. You need to monitor him really closely. Here's what to look for. Look specifically in this spot. Sure enough, 6 months later, he was back because he had this little divot in his stroma here, so indicated by the white arrows. And he stayed in hospital with us. Over the next few days, this progressed, it got deeper. And so he had surgery on his left eye as well. So just an example of how this can start as a unilateral disease affecting one eye, and then, in the future, go on to impact the other eye. So treatment, monitoring these eyes very closely is super important, because they can develop corneal perforation, really, really quickly. They can lose stroma quickly and essentially perforate in a matter of hours to a day. Because it's a bilateral disease, that can be incredibly problematic, especially if the horse has any, concurrent issues that may make it not a great candidate for surgery if it needs general anesthesia, that kind of thing. And so if there are bilateral perforations, that's a reason that a horse would actually need to be put down from its ocular disease, which is not very common. So surgical stabilization of the cornea is considered the gold standard, and the surgery that's performed is really going to depend on how deep the lesion is at the time it's assessed, as well as just the surgeon preference that's treating the case. But we do know that these tend to respond well to conjunctival pedicle grafts. So that may be kind of the sole treatment that's recommended, or the conjunctival pedicle graft with some other sort of graft underneath it, like donor cornea, or some of the synthetic grafts that we have may also be a recommendation. So this is a horse, this is actually the horse I referenced earlier, that had bilateral conjunctival grafts performed at different times. These grafts, as opposed to the one I showed earlier with the corneal perforation, have pigmented. So they've developed kind of dark brown to black pigment on the surface, which actually makes them look a bit more cosmetic. There's not that kind of pink slug sitting on the cornea. In these cases, I typically advise that we not trim the pedicle, mainly just because we don't know what's causing this stromal loss. And so leaving the blood supply there, I think, should the horse develop any issues around the graft site in the future, leaving the blood supply there is only going to help us. So this is one condition where I would advise against trimming the pedicle, unless it's thought that the horse is having significant visual impairment from the graft, in which case may consider doing it. Okay, so relation to other collagen disorders, and Angie, hopefully this will kind of answer your question. So we know that Friesians have, genetic disorders that affect collagen elsewhere, dwarfism with joint laxity, megaesophagus, hydrocephalus, potentially others. So is this eye disease potentially a manifestation of, kind of the same underlying issue with collagen that they may have? If you want to go ahead and advance, this was investigated. It's a really good kind of working hypothesis that all of this stuff could be related. So this was investigated by Dr. Rebecca Ballone's lab, with the knowledge from the initial case series that males predominate, 8 out of 9 cases in that were male, suggesting that this could be X-linked. So this could be a condition that is due to a genetic variant on the X chromosome that would kind of easily explain why more males are affected than females. And a solid candidate gene on the X chromosome is a gene called biglycan, or BGN for short, which is involved essentially in collagen regulation. So this gene was sequenced in a number of cases and controls, and they did find variants within the gene, but none that were associated with the disease phenotype. And some of them, most of them were fixed in Friesian. So every Friesian that they sequenced had those same variants. So kind of came up empty-handed here, but important to rule out this one specific gene that was a good functional candidate on the X chromosome.
Yeah, it's definitely very interesting because, as you know, we're studying megaesophagus at the University of Kentucky, and it's also been noted in other papers related to megaesophagus that have previously been published, and I think potentially aortic rupture as well, that there's a higher prevalence of male versus female cases. And it is very interesting to think that there's nothing obvious that's causing that stromal loss, like an injury or an infection. And it certainly does, at least theoretically, a line where you could see a potential connection possibly. But the pathway that regulates collagen production is extremely complicated. There's a lot of things involved in it. So it's definitely all the low-hanging genetic fruit has been picked. So we are definitely working on these more complex diseases right now.
Yeah, absolutely. So kind of based on the fact that biglycan was ruled out, the next kind of logical step to investigate the genetic basis of this disorder was to do a genome-wide association study. So this is the same type of thing that was done for the Distichiasis, where the kind of genetic material from cases, so bilateral corneal stromal loss affected cases, was compared to the genetic material of Friesians that were known to not have this disease. And the controls for this were horses that were older horses. So we know that BCSL, or bilateral corneal stromal loss, essentially can affect a number of different ages of horse. It can be a young horse up to an old horse. So our control horses were kind of at an advanced age, above the age of 20, to make sure that they, truly did not have this disease. And I thought I was intimately involved with this research project during my residency, and I thought I had won the jackpot because this is a nice looking Manhattan plot. We have a tall building on chromosome 19, and so I ran into Dr. Ballone's office and said, I think we found it. This is awesome. If you want to go ahead and advance. Oh, I forgot to put that there. Yeah. So that's me. That's me as a young, naive, genetic student. I should preface this with saying I am by no means a geneticist. I'm a clinician by training, but I had the wonderful experience of getting to work closely with Dr. Rebecca Ballone, and through her, some other geneticists. So, have developed some understanding of genetic disease in horses and how to investigate them appropriately and that kind of thing. But my day-to-day is looking at horse eyes and trying to fix them. So, but what we found was that area of the genome that was marked in that Manhattan plot from the genome-wide association study is what people call a gene desert. So there are like no genes there, like none at all. There's one nearby. It's a gene called LSAMP. And we sequenced that gene in a bunch of cases and controls and found nothing. We found a couple of variants, but none of them that, segregated with the disease phenotype. So we don't think it's associated with the disease. So kind of a bummer there.
Back to the drawing board.
Yeah, exactly. Back to the drawing board. You can go in and advance there. Yeah,
Oh,
so
sad.
that's
Yes, I
sad.
have felt that feeling many times.
Yeah. So what do we know so far about the genetic basis of BCSL? We know that males predominate. The more cases we have, we do have more females coming in, but males definitely predominate. There are more males than females affected. However, we haven't been able to identify anything obvious on the X chromosome as associated with or causal for this disease. We know based on that genome-wide association study that we have a region significantly associated with the disease phenotype, but we don't have a functional candidate gene in that area. So we certainly, are not close to identifying the causal variant there. That said, the region in that area suggests that this may be inherited in an autosomal dominant form,
Oh, no.
because the cases, only 10 of the 19 cases had what we call the same haplotype, so the same kind of genetic makeup in that region, but they were heterozygous, meaning that they had one copy of it rather than two, and none of the control horses had the same genetic makeup. So it is significantly associated. What it means, we don't know at this time. And you can go ahead and advance again. So where do we go from here? We definitely need more cases. We have a fair number of cases, but we need more. It may be that our genome-wide association study was just underpowered, and that if we get more cases and more controls, we may be able to more accurately identify regions or a region of the genome that is, significantly associated and will lead us to that causal variant. We also could use whole genome sequencing data. So like they did with the Distichiasis cases, we could sequence the entire genome of affected and unaffected horses and kind of scrutinize that. The problem there is it becomes harder than looking for a needle in a haystack. It's so much data. And so you have to go about it in a very organized fashion. And we certainly do have, a list of genes that we know are causal for or associated with other genetic disorders in Friesians. And there are ways to kind of go about it and try and find that causal variant. But it's also possible that it's not as simple as a variant that's inherited in a simple fashion, whether it be on the X chromosome or any of the other chromes. It may be that multiple genetic variants have to be present in order for this disease to manifest, or that there have to be one or more, genetic variants, but also exogenous factors, environmental factors, maybe not trauma, but maybe things like stress. If you want to go ahead and advance to the next slide, one thing that I've noticed in a few horses, and that's also reported in the case series, is that some of these horses presented with unilateral stromal loss and were hospitalized for that, either for monitoring or for surgery. And during the course of hospitalization, where it's incredibly unlikely that they would traumatize their eye, they develop, the stromal loss in their other eye. So it can happen in just a matter of days. And, there is a big question about what exogenous factors might be at play here. Could stress, lead to this disease manifesting? There's also a few kind of anecdotal reports, and then also a mention of it in the initial case series that there are a few horses that have been seen to have mild stromal loss that on re-examination later in life, usually years down the line, their corneas appear to look normal. So some of these horses may actually be having spontaneous resolution and kind of a waxing and waning disease course that does not progress to perforation. So there are a lot of unknowns about this disease. It's a very strange disease, a really interesting disease, but we hope to, be able to learn more about it as we go.
This is just more of a comment, not a question so much, but Donna says, I guess I'm the lucky winner as my 22-year-old Friesian mare has this. and she
Oh,
has it in one eye at this time, but has lost the vision in that eye.
oh, I'm
So
sorry to hear that.
it can definitely happen in mares as well.
It can, yep. Yeah, we have, like I mentioned, the more cases we identify, the more females we're seeing, but the male predominance is still kind of holding up. Males are affected more so than females. So,
That brings us to the questions. Yeah, so why, I guess while we're, I guess I will go ahead and let the audience know if you have questions or you're thinking about asking a question, please use the chat box in the bottom. Um, I think that that is such a, and I hate to use the word fascinating because it's certainly not fascinating or exciting for anyone if that happens to their horse, but from a scientific standpoint, it is a very peculiar disease, very, very interesting indeed, as far as all the factors that you described, and especially how quick it could manifest just in a potential stressful situation. That is kind of mind-boggling what might be happening there.
yeah, absolutely. The case series that was initially presented compared it to a corneal, what we call dystrophy. Dystrophy is a term that's used to describe kind of heritable changes to the cornea, and it's probably not the best term to use, but compared it to a disorder called pellucid marginal degeneration, which is described in people, and it looks somewhat similar. They develop focal areas of thinning of the cornea. Males are more commonly affected than females. I don't know that they've identified a specific genetic variant for that, but it is, I believe they think it to be X-linked. So, you know, during the initial stages of investigating this disease, I think we were all hopeful that it was going to be very similar and that we'd, be able to find the variant and that kind of thing, but we just haven't been able to. So I think that, this is a disease that if it's caught early, it can be managed and it can have a good outcome, but there's just so many unknowns about it. And because it is bilateral, it really is a significant, concern for Friesian owners.
Yeah, that is certainly definitely a concern. And they are actively studying this at UC Davis, correct? If somebody had a Friesian that was diagnosed, they could participate in the study, correct?
Yeah, Dr. Balone and I actually have an ongoing study to investigate it. So certainly if in the audience, if you have your horse that's affected or know of anyone, please reach out to me or to Dr. Balone, and we can get you set up with the information that you need. It would be awesome to, enroll a lot more cases and to be able to figure this out.
I have another question from Donna here. She says the vets did tell her that her mare has a lot of inflammation in the back of her eye, but they did not feel they needed to take the eye at this time. She wants to know, how would she know if her mare is in too much pain? She obviously wants to do what's best for her. She actually plugged the cornea with her iris and healed it herself for the time being.
Yeah, that's a really good question. And that brings up a good point in that the eye is pretty good at healing itself. Whether or not it can maintain vision in doing so is kind of always a question. But it sounds like if her corneal wound is healed, then she should probably be, pretty comfortable. Our indications to remove an eye are when an eye is irreversibly blind, so we know it won't see again, and it's a source of known untreatable discomfort for the animal. There are of course kind of caveats to that. Cancer would be one. If there's a tumor, those rules kind of go out the window, but I think monitoring for discomfort in a blind eye, things to look for would be, is she holding the eye open or closed? Does she have a lot of discharge? Are flies a problem from the discharge? Is she quiet? Is she sensitive when you touch that side of her face? Those are all things that can really indicate whether or not the eye is a source of pain for an animal.
This is just a general question about, eye issues. Are there fly masks that are safer or less safe when it comes to potentially, accidentally poking the eye or injuring the eye when they're rubbing their face on a tree or something like that when they have a fly mask on?
Yeah, that's a great question. There are so many fly masks on the market right now. The ones that have some sort of kind of, rigidity to them and stay out from the eyes are probably considered safest. That said, those aren't always well tolerated by some horses, and they may be easier for them to get off, and they may do more damage to their eyes when they're trying to get them off than, a regular type of fly mask would. So I always tell my clients the best fly mask for the horse is the one that it will, keep on comfortably without trying to take it off. If we're talking about, horses that have a lot of UV exposure risks, if they're prone to squamous cell carcinoma, that kind of thing, then I recommend use of a 90% or greater fly mask. So a UV blocking 90% or greater fly mask, which can really help to limit the amount of sun that's getting to the eyelids and the ocular surface. Obviously for Friesians, that's not a huge concern. They have so much pigment that's protective. They can certainly get squamous cell carcinoma, but they are not a breed that's particularly prone to it. So yeah, whatever mask your horse will keep on is probably safest.
Okay, and do
Yep.
you,
So someone just put in the Q&A. I've used the Equine. Those are great masks. They're good quality. They're not very expensive, and they do provide UV protection. So
also, is there any correlation between more or less injuries depending on how horses eat their hay? For example, horses that are eating hay loose out of a round bale, and maybe they're sticking their face into the bale to enjoy their meal. Is that more of a risk for injury to the eye versus eating like a flake of hay on the ground or hay from a hay net?
yeah, that's a really, really good question. And I would love to know the answer to that. We just don't know. I think there's a potential for, trauma from hay or, whatever forage they're eating, or anything in the stall or the fence or, trees in the pasture. They're potentially always at risk to bump their eye on something. So I don't think anyone has specifically looked at hay and how it's fed in round versus square bale versus hay net versus on the ground, that kind of thing. But it would certainly be interesting to do so.
I think that is our last question. So on behalf of the Fenway Foundation for Friesian Horses, we want to thank all of you for attending tonight's webinar. And we also want to thank you for your patience because we had several unexpected technical difficulties, but we appreciate you guys hanging in there with us and understanding that sometimes technology just has a mind of its own. And tonight was one of those nights. But if you have additional questions, Dr. Knickelbein's email address is right there. Feel free to contact her. And keep in mind, as she mentioned, about the study that's happening on bilateral corneal stromal loss. So if you know of anyone, and even if you're in another country, I think usually we can, at least Fenway Foundation, I know we could help coordinate samples if we had somebody in the Netherlands that needed to get something shipped over. So we'd be glad to help connect you with the study. This webinar was recorded and we will add it to our website shortly. So you can explore this webinar or the hundreds of educational articles on the Fenway Foundation website in our library, and you can view them by going to www.fenwayfoundation.com. So thank you, Dr. Knickelbein, for being here with us and giving us this really important information for Friesian owners. Thank you all of you again for joining us tonight, and we'll see you at our next webinar, which should be in a few weeks. And so have a great night and thank you.